Hi, friends, and welcome to the Exam Room with Nurse Alice, the show where we take a closer look at things going on in the world today. And trust, know, and believe there's a lot going on today, and we're going to get into some of those things very shortly here. But first off, I want to thank blackdoctor.org for allowing us to have this platform every Monday, 6 p.m., 9 p.m. Eastern Standard Time. You can find the Exam Room with Nurse Alice here every Monday. So make sure you tell Alexa, Siri, have your secretary put it in your work schedule, all of those things, put it on the calendar, let the kids know not to bother you during this time, because this is the time where we're going to talk about all things health, wellness, love, lifestyle, and things to help you live a happier and healthier life. So also want to thank one of our show sponsors, Nurse Approved. You guys are getting back to school, back to work, back to the office, you're traveling. We're still in a world pandemic. If you're looking for a travel kit, something to help you feel safe and secure when you're out, just in case you sometimes run out without that mask, you can get a Nurse Approved travel kit. Comes with 2 KN95s, hand sanitizer, 2 pairs of gloves, and 10 antiseptic wipes. You can visit imnurseapproved.com, and they're having a back to school special, so you can still put back to school for your 20% off. And make sure that if you're looking for something of quality and safety, make sure it's Nurse Approved. Okay, so y'all, we're gonna have a good conversation, because yes, we are still in a world pandemic. I know y'all are tired of talking about COVID and quarantining and all those things, but this is real. This is our new normal. And some of these things that are coming with our new normal, I don't know if y'all have heard about the quarantine 15. I have, because I have been struggling with it, as well as many of the friends and patients and other people that I know. So we definitely wanted to get into this conversation, not just because of quarantine 15, but because we know that our weight is something that's very important to us, not just physically, but internally as well, because we know that being overweight and obese can lead to a whole bunch of chronic medical conditions. Diabetes, heart disease, cancers. It puts us at risk for so many other things. And so although I am a nurse and I am very familiar with weight loss and eating healthy and exercising, I needed to bring the experts on here to break it down for us. And to give you all an opportunity to ask the questions that sometimes we're a little shy, ashamed, or maybe don't think to ask when we're with our doctors. And I'm just gonna be honest, I love my doctors, but sometimes you gotta make sure you're asking the right doctor with the right experience. Now, I love all doctors, like I said, but there are specific credentials, certifications, board certifications, and things like that. So we really, really wanted to get the experts. So I have 2 wonderful experts who are joining our conversation today to help us discuss weight loss, myths, and management. And also, before I introduce them, I also want to encourage you to please drop your questions in that chat box down there, because we're going to get to all your questions, comments, share your stories, because we are a family here, okay? So we have experts, but we definitely want you to, if you have a success story, chime in, share with one another, because it really takes a village. So first, I'd like to introduce Dr. Dianah Lake. She is your total fitness and wellness expert. She is also known as Dr. Di. She's an emergency room physician, menopause wellness expert, fitness and weight loss coach. She's a best-selling author, physician, speaker, autism parent advocate, and founder of Dr. Di Fit Life. And she uses her clinical experience as an emergency medicine physician and her knowledge and passion of fitness and weight loss to help you in a holistic approach to disease prevention. So welcome to the show, Dr. Di. Dr. Di, hello.
Hi, guys. Thanks for having me, Nurse Alice.
Thank you. So glad you could join the conversation. And listen, y'all, she's sitting down right now, but the sister is built. She has workout class. Really, she will help you sculpt a fit, healthy body that you absolutely love. Okay, and we'll get into that. We'll get into that too. But also joining the conversation, we have Dr. Rameck Hunt. He is a double board certified physician in internal medicine and obesity medicine. He's a clinical researcher on obesity and the founder and medical director of the weight loss management program at Penn Medicine Princeton Health. Over the summer, Dr. Hunt also released his first medical book, The No Guesswork Diet. It's based on his unique program that's helped hundreds of his patients lose weight and keep it off. Secret, keep it off, right? That's what we all want to do.
Yep.
He takes a radical position that helps a person with obesity understand that it's not, obesity is not at fault, and that losing weight and maintaining the loss is more than just willpower. Oh, that's good to know, because a lot of people say, oh, it's just willpower. It's all about decisions. But Dr. Hunt's going to let us know that there's a lot more to it. So thank you for joining us, Dr. Hunt.
Thank you for having me. Thank you for having me.
All right, great. And people are joining the conversations. Good evening, Lena, Latanya, Yolanda, Gerard. Thank you so much. And you guys, also, please make sure you do a watch party, because this is some great information. Sharing is caring, okay? So help your friends. We all know somebody who needs this information. Hello?
Yes.
Yeah. Okay, so now let me just put the question out there. Dr. Lake or Dr. Hunt, whoever wants to grab this one, could you give us the current state of America and obesity? Like, where are we at? Are we doing better than the last 10, 20 years? Are we worse off? Where are we at? Dr. Hunt.
Go, Dr. Hunt.
Yeah, so we're not doing so well in our numbers. When obesity climbs about 1% every year. So when we were about 5 to 10% back in the 1960s and 70s, we're now currently at 42.4% of obesity. And if you add overweight to that number, we're almost 75% of all adults with overweight and obesity. So this is truly, this is the biggest chronic illness that we have in this country. And it's truly an epidemic. And we really do need to start treating it as such.
Now, it's interesting that you say that, because I don't know that everyone really looks at obesity as a disease. We don't. We just think, look in the thighs, love my curves, and that's just how it is. And, love who you are and just being voluptuous. And voluptuous is sexy. I'll give it to everyone. But can you guys explain to us more about obesity and why it's a disease? Like, why should I be? I mean, I hear some things. I understand, like, you're going to tell me that increases my risk of heart disease and diabetes, but like, what's happening inside that actually makes that possible?
So we always used to think that the fat cell itself was just for cushion, a little cushion for you and insulation. But turns out that the fat cell is a metabolically active cell, one of the most metabolically active cells that we actually have. And it produces these chemicals, these cytokines, what we call these little signals that talk to other parts of your body to make things happen. And when the fat cell becomes what we call diseased, what is called adiposopathy, it actually turns on genes in that fat cell that then cause you to get high blood pressure, that then cause you to get insulin resistance, and then diabetes, that then causes you to have inflammation and then cause cancer. And all of these things are going on in the fat cell. In that fat cell, if you don't get rid of it, it will continue to cause all these problems and wreak havoc in your body.
Okay.
And another thing I would add to that, Nurse Alice, is also like Dr. Hunt said about the inflammation, right? So the thing about diabetes, I think, especially in the African American community, that we think of diabetes because so many people in our families have it. It's kind of like the norm, like, oh, it runs in the family, right? And it doesn't have to. Because it's a preventable condition. It doesn't have to. You can make behavioral changes, which is why we're here to talk about this now, is to just get some of these myths out of the way, is you can do things to make the buck stop with you. Like, let that whole paradigm and that whole thought of, oh, this is just something that runs in our family, it needs to stop, right? Because it doesn't have to run in the family. You can do something about it. You can be that change for the rest of your family, the rest of your, like, the legacy of your family, all the generations to come, to have that change by you taking the interest to say, okay, I'm learning this information. I'm going to apply it to my life. I'm going to share it with my family. I'm going to share it with my friends. So we stop this whole, from generation to generation of carrying these false, thoughts and miseducation about chronic disease. So the inflammation piece is huge because all diseases really start with inflammation. So if you're changing the way you eat so that things that you're eating and consuming are anti-inflammatory, then you're really going to be working toward preventing diabetes, which is a disease that affects almost every organ in your body. I don't think people really understand how terrible the condition of diabetes is because it's so commonplace. We just throw our hands up and say, oh, it runs in the family.
Right.
But understanding the on the cellular level, what's happening when your body becomes insulin resistant, what's happening on the cellular level with inflammation in your body, and the cells are literally mutating and increasing your risk for cancer and all these other things. When you get that global, concept down, I think then it makes it easier to say, oh, wait a minute, this is a much deeper thing here, and I need to pay attention.
So what I'm hearing, thank you so much. And so what I'm hearing is that obesity is really a hormone disease and that it triggers this inflammation, which kind of sets off this cascade for so many other things to happen in our body. And Dr. Hunt, I know you said about 75% of the population is overweight or obese, but I didn't just become an adult and then become overweight. So I can't help but believe that some of this, obesity is starting as a youth, and that this inflammation is actually even starting earlier on in life. Am I correct by saying that? Or
yeah, Nurse Alice, you hit the nail right on the head. The sad part about that is we used to call, getting back to type 2 diabetes. Type 2 diabetes is the one that you get later in life. And so we used to call type 2 diabetes adult onset diabetes. And the reason is because 0 kids in the 1980s had type 2 diabetes because it was a disease that happened as you got older and then as you gain weight. Now, as of the last 5 or 10 years, over 100,000 kids have type 2 diabetes. And it is because we have our children have gained a lot of weight in their youth. And so all of the diseases, a lot of the diseases that you would normally only get when you get older, we're getting them a lot sooner now because of obesity.
Wow. So it sounds like if we could just target obesity and get a real handle on that we would be able to bring down our cardiovascular disease numbers, our diabetes numbers, our cancer numbers, and all of those things. So that's really kind of the underlying common thread among these. Okay,
you're hitting it on the head.
Hello, knock, knock, knock. This is why we're having this conversation, because we know, and blackdoctor.org, many of you viewers are people of color. We are too, right? And so we gotta talk about this. We gotta talk about it because we are number one in these areas, and those are races we do not want to be winning. So we gotta get to the underlying factors, and a lot of that is our weight. And I know culturally and historically we have celebrated our curves and love them, and I love them too. But it's not. I want to get away from just what it looks like, but what it's doing internally, because that's the important part. That's the piece that's going to matter. But let me. So if this is happening with earlier on with our kids, gosh, when people say that it's in my genes, is it really in our genes, or is that really more of a lifestyle that we incorporate in our lives so that it's continuously happening? Which is it? Is it more environment and lifestyle, or is it more genetic with this obesity stuff?
So obesity is a multifactorial disease, so it has many causes. It's your environment. We live in an obesogenic society. It is your genes too. There's a gene called the FTO gene that manages some of these things. And then there are the way we live. Like we don't even we don't move as much, right? We everything is automated. Like we don't even go to the store anymore. We just order it online. We use our fingers, right? And now we don't even do that. Now we don't even have to move our fingers. We don't even burn energy doing this. We just go, Alexa, order me some paper towels. So is getting to a point where we're gonna be like, I wrote about it in the book, like it's gonna be like Wall-E, where you're just gonna be sitting there and you're just gonna have to think your thoughts and everything will come to you. It's like it's gonna be so
Artificial
automated.
intelligence rules the world.
You know what? That raises
So
a
I'd
good.
like to add something to that, actually, Nurse Alice. I mean, I think it's a great point to Dr. Hunt. The other thing I would add is when it comes to this whole hereditary thought process, is very prevalent in the African American community. Everything, we come up with excuses to explain it away, right? So, and I'm just putting it out there. It's the truth, We'll say, oh, I'm big bone, or, oh, that BMI chart doesn't even apply to Black people. Now, mind you, I agree to a degree about the BMI chart, right? I'm 165 pounds, but I have a lot of muscle, but I'm pretty lean, and still on the BMI, my BMI is like 25 point something. So if you went by that, it would say I'm obese. Clearly, I'm not obese, But for Black women especially, we don't like the BMI chart. We don't like those things because we feel like it's not taking into account the curves and all those things, right? So that's in our minds that when we look at it and we're like, oh, I'm not fat. What y'all talking about? I'm not fat. But the numbers still show that African American women, 80% of us, that's 4 out of every 5 sisters, okay, are overweight or obese. Yeah. So that number is real. Whether you're thick, big bone, whatever you want to call it, at the end of the day, that number is real. 4 out of 5 of us are overweight or obese. And if you think about what that number means for us, as a sub, group, that's huge, 80%. So we can't just say, oh, it's just my thyroid, or oh, it runs in the family. At some point, you have to start taking ownership of it. At some point, you have to start saying, okay, I am the common denominator here. How do I make changes in my behavior, changes in my eating, changes in my sleep, changes in, the stress in my environment? All of these things come into play. Like Dr. Hunt was saying, it is multifactorial. So you have to look at the mindset that you have toward physical fitness and wellness and all of that. I think all of that comes into play as well. And we can't just chalk it up to, oh, this doesn't apply to us. Okay. Because that's a very easy way to excuse yourself from being responsible.
Exactly. No excuses here. And so this is starting to get really good. And Kathy and Yolanda, we're going to get to your questions very shortly here. I just wanted to go into something before we get to that. But let me ask this. You mentioned BMI, body mass index. Now, is that the number that we should be focused on, or is it the number on the scale that I should be focused on? Because, people will go on the scale or even be afraid to get on the scale because they're afraid to see that number. Because like Dr. Lake, you mentioned, I think you said you weigh 160, but you're very fit and, very muscular. So, so what do I use as a metric to know if I'm really overweight or if I'm obese? If this
I prefer the body fat percentage.
Mm-hmm.
I prefer the body fat percentage because your body fat percentage is saying how much body fat you have versus lean muscle. You're looking at that ratio. You can have 20 people be 165 pounds and all look different because of their body fat percentage. You can have a very plumpy 165 and you can have a very lean 165. So the number within itself, and you can expound on this, Dr. Hunt, but the number within itself, it's not the whole story. It's one indicator, of many. So when I'm training people, in my coaching program, I'm telling them, look, we're looking at your weight. You have this number in your head. Oh, I want to hit 150 pounds, say, for example. Yes, but what are you going to look like at that 150 pounds? You can lose 20 pounds, get down to 150. If you don't have the muscle tone and you don't have that sculpting around it, you're still going to look bleh. It's not going to be like the way you want it to look. So you have to have that resistance training in there too, so that you basically sculpt your body to look a certain way. So when people say they want to lose weight, what are you trying to do? Just lose fat? Or are you trying to get a complete transformation where you're sculpting, you're toning, you're improving your sleep, you're doing all the other things that goes with it? and you're feeling great as well. You're losing the fatigue, right? You're increasing your energy level, and you just feel amazing. That's what you want. You don't want to just lose number on the scale.
Okay.
That within itself is not wellness.
Yeah, I
Yeah.
agree with Dr. Lake. I just wanted to add to the BMI thing because there was a lot of stuff in the news about it. Some professors wrote about it. The BMI is important because it is a very easy and reproducible thing to use, and you can actually use it in studies. So it is important in that sense. But just like Dr. Lake said, the BMI does not tell the whole story. Because you can have a football player who's all muscle, and it would say he might be morbidly obese. So you have to take everything into account. And so I use the body composition. Like we have a body composition machine where we measure fat mass and we measure muscle mass. So and we take the percentage, like Dr. Lake said, of your fat to see how metabolically healthy or unhealthy you may be. And not only just that you have the fat, where is the fat? If the fat is in your belly, if the fat's in your belly, that's a problem. Like there are certain Asian populations, their BMI is lower. So it's 34 in America, but Asians' BMI is 27 because if they carry that fat in their belly, they get diabetes before they get to a BMI of 30. And so it's very important that the BMI gives you that's like a poor man's test to say, okay, well, maybe I should look at this a little closer. But once you look at it, that's not the end all be all, but it is the first screening test. And it's very important to have a screening test. You can't just say, well, so if you don't use a BMI, what are you going to use? You need something to start the process. And so that just starts the process. And then a physician, if they know anything about treating obesity, then they know how to look at other markers and other things and body compositions. And then you can really get into if this person's at a healthy weight or an unhealthy weight.
Okay, good. Ooh, that's
one more thing about that. Then the other thing that tells us that you're healthy are the other indices, your cholesterol, right? So it's not just a number on the scale. It's not just your weight. It's what is your cholesterol, right? What are all your cardiac risk factors, right? So we're talking about basically your risk factors also for diabetes. What are your risk factors for blood pressure? What are your risks, So looking at all those things and looking at your kidney function, looking at your hemoglobin A1C, like looking at all those other things that can tell us generally how healthy you are. And then maybe checking you out to check your endurance. Can you run a mile? That's the other thing. People think they look healthy. You can look healthy and be very unhealthy, right? You can have the physical appearance of health, but then you put somebody on a treadmill after 5 minutes, they have no endurance. So all of those things are indices of health. It's not just your physical appearance. What can you do when we put you on a track? Can you run and catch a bus and not be winded? Can you play for 5 minutes in the park with your kids and not feel like you're about to have a heart attack? So endurance is another thing to look at when you're talking about how healthy you are.
So what I'm also hearing from this is that when we're looking at our weights, it's all in obesity and being overweight. We really want to look at, not just the numbers on the scale, but looking at our quality of life. So some people, when they think of weight loss, literally, I'm just gonna be honest, because I know I'm talking to somebody out there, they just want to get skin teeth. That's all they want. They just want to they just want to look the part. They don't care about being the part. They just want to look the part. But you can still be slender and slim and look healthy, but have high cholesterol, diabetes, hypertension. So it's not healthy. So we're looking at quality of life, overall health. But generally, when you lose weight, you lose it the right way, and you encompass those lifestyle activities of eating healthier, exercising, getting good sleep, stress management, all those. Then, stop smoking and all those things. All of that is helpful. Okay, so real quickly. So it sounds like, so let me get back to the BMI. The BMI is like the first place to go. So anybody, you guys can check your BMI. You can Google the calculator. All you need to know is your height and your weight, and it'll give you your BMI, and that's an excellent point to start. The other, the body composition machine and the body fat and all that measurements sounds like you need to go to a healthcare provider or your doctor and get those measurements done. Is that where I'm going to get that information from? If I want to look at something beyond the BMI, where do I go?
So
Amazon.
You can find anything on Amazon. No.
So in my clinic I have a really fancy schmancy one, but you can get it at a doctor office like my office. But some gyms have these they call it BIAs, bioelectrical impedance analyzers. Those are the easier ones to use. But Fitbit or all these other, you could go to Best Buy and get a basic one that will track your fat mass.
Okay, good to know. Now,
and the basic ones are decent because it gives you other parameters you can trend. I'm a geek, okay? I'm a geek all day long. So stats. With my fitness plans, I want to know the numbers. The numbers do not lie. So if you have something like an Apple Watch or a Fitbit, like Dr. Hunt was saying, or even one of those scales, like the digital scales, they'll tell you it'll give you a cursory number for your body, body fat and all that kind of stuff, and you can trend it over time as you're losing weight.
Okay, and you call
it trending is important.
Okay, but you called it a BIA, body. What was it again?
Bioelectrical impedance analyzer.
Okay, y'all, you heard it. So if you're gonna go to Amazon, Best Buy, that's what ask the salesperson.
Or the easiest way to just say they'll know what you mean if you say body composition.
Okay, there you go. Okay, perfect. So there you go. So y'all can get to shopping. You're welcome.
We lost.
Did we lose her?
We lost. Oh my goodness, how'd that happen? We might have to do the show, the rest of the show.
Hopefully she'll come back on. She'll
be back on. But yeah, so there we are.
There she is.
I was trying to order my
we can't hear you right now. Now I can hear you.
I was trying to order my body composition machine in the other Okay. Sorry, y'all. Okay, real talk. Let me get into some of these questions.
We were about to just keep going without
you. We was gonna keep going.
I love it. Okay, so let me answer some of these questions because people have been asking questions. So Yolanda K. Pollard says, I was able to lose weight, but now I can't. I don't know what's going on with my body. I do have thyroid problems, but I'm always told my levels are good. What about the balloon surgery? Ooh. Well,
okay. So that's a lot of information not given to jump to balloon surgery. I mean, I'll say something, and then of course, Dr. Hunt's going to have his to chime in. But a lot of times when people come to me saying they've plateaued, because that sounds like what she's saying is she was able to lose weight, but now she's plateaued. So typically, when I'm working with a fitness client who's plateaued, I look at what they're currently doing. I look at their nutrition. I look at their the intensity of their workouts. I look at areas that I can change things. Are they using supplements? Are they not using supplements? How's their sleep? Are they doing other things that are sort of shooting themselves in the foot? Because maybe they may be eating well, but they're not sleeping well. So if you're not sleeping well, you can work out all day you want. But if your insulin level is high, your cortisol level is high, all those things are high, your growth hormone is low, all of those hormonal things can affect your progress. If you're also menopausal, that's a whole separate, situation that can really affect your ability to lose weight, because a lot of women in menopausal age range will gain weight. So then you have to look at their hormone levels. And, so it can really, you have all kinds of different pathways you can go with that, depending on the person. So we're not getting all the information to really truly answer this question.
Right. So
what I would add to that too, so I agree, Dr. Lake. What I would add to that is that you need to go see someone who specializes in obesity, because we would look at these different things and then tailor a plan to you, because there's always a reason why you hit a plateau. There's always a reason. We just got to figure it out. And so when people come to me, I get the data from them. I make sure they track. Everybody knows you got to track my program. If you don't track, then don't come back.
I Listen,
You gotta,
you want
so
results, you gotta watch
You
the
gotta do
numbers,
the work.
right?
You gotta do the
yeah.
work.
So
Yeah.
give me the data, and I will tell you what it is that we need to do to help you. And we try in our program to make sure people aren't always hungry and always craving. So we have strategies to address those things because I don't. It's going to be a battle. I mean, everybody got to work, at getting to a healthier way to, getting to where they want to get to. But I don't want to make it so hard when I know that there's things I can do to help them along in this journey. But
Absolutely.
I would say go talk to somebody. So and the one thing I'll say, and then I will get another question, but obesity is the only disease, and it's the biggest disease in America, but it's the only disease that doctors and even people, the patients themselves, where we expect patients to treat on their own. We go, you eat less, move more. That's all we say. And then that's why people are doing all these different tummy tuckers and this a shake, that a shake, because we're not giving any guidance. And there is medical guidance on and algorithms and guidelines on how to treat obesity. And because not enough of us are trained in it, like we just leave the patients to their own devices, and then they get frustrated, and then they regain the weight. And that's the biggest part of losing weight, is regaining it, because 80 to 90% of people who lose it regain it. So we are very good at losing weight. We're just not good at maintaining it.
Wow. Wow.
And to piggyback off of that, the way that a lot of people are losing weight is this, oh, I want it now. We're in this, Insta culture, right? It's like you gained this weight over 20 years, but you want to lose it in 2 months, and obviously that's not the safest way to do it. So as Dr. Hunt was saying, you need strategy, you need a plan. Just like any one of us who have done anything with our careers. You had to go through some kind of schooling, you had to do testing, you had to do all of those things to get the credentials you have and to have the job you have, the career you have. You didn't just show up one day and instantly all the training came upon you. There was a process. So treating obesity and treating, weight management is the same thing. There needs to be strategy with it. You need to have a process you're following. You need to have check-ins. You need to have benchmarks you hit every week. You need to have structure around it so that you can maintain it and create a lifestyle around it, so that it's not just this thing you're trying to hit and then it's done. It's never done. It's your whole life. You're going to be dealing with this. So it needs to be, yes, it needs to be, absolutely. It needs to be something where you're thinking of it as, this is my new way of being. And so your mindset around it needs to be like, why is this important to me? What is the relevance? I'll tell you, for me, my father died from diabetes. I saw him on a ventilator. I would never forget that. So for me, that was the impetus to go do something differently. So for you, you need to think, how is this affecting my life? What is going to happen if I don't change this situation right now? What is the cost of me being this way? I'm being for real right now. Like, you need to think of it and think about the cost it's going to cost. Are you going to live long enough, of all things being equal, are you going to be around to see your grandchildren get married? Like, think about, what is your lifestyle currently costing you? Confidence-wise, self-esteem-wise, walking into a room and thinking that people are looking at you because of your size. Like, there's so many other emotional things that go around, that go on that come along with the obesity. So just tackling all of it, not just the weight, and all the social, emotional, mental things that go with it. Really tackling all of that is important.
Yes, and Dr. Lake, along the lines of emotional, we had a question from Kathy Garcia. She says, what about stress weight gain? Many people eat properly, but we're stressed out and we produce too much cortisol, hence weight gain. So can cortisol, with the stress, yes, we have increased cortisol levels, but is that enough to gain the weight? Or is there more to it than just a rise in our cortisol levels? Dr. Hunt.
So I hear a lot about cortisol and as it pertains to weight gain. So stress and the things that change in your body, like cortisol, can affect your weight. Cortisol is a steroid. It's a steroid hormone, and so steroids in and of themselves can cause weight gain, as we all know if you take prednisone. And so yes, cortisol can add to weight gain, but I don't know if we have any good studies that showed that you can isolate cortisol by itself and see if that's the only part that plays in somebody's weight gain. Did that stress that raised their cortisol make them eat differently, make them sleep differently, like Dr. Lake said, make them not exercise like they were supposed to? So it is hard to take cortisol in isolation. And to be honest, who cares? Like, like, why do we care if cortisol contributes to it by, one little factor, when what we really should be dealing with is the stress or whatever it is that raised the cortisol. So like, I'm not sure why. I mean, we all try to find different excuses and reasons why things are not working for us. But that's why I think you should go and see someone who trains in this, because one of the things, what I like to do is to tell the patients, it's not all about willpower. There are reasons in your brain why you crave and why you're hungry. And it's all a hormone game. And if I can help you get your hormones regulated, and not just testosterone and estrogen hormones, but their hormones, this hormone called ghrelin. Ghrelin is your hunger hormone, and it's in your stomach, and it makes you crave, and it makes you crave, and it makes you crave. And
the gremlin.
Yes, it's like I call it the gremlin hormone. And you have a set point in your brain. You have a lot of set points. You have a set point for your pH. Your pH is set at 7.40. If you deviate from that set point, your body is very good at getting your body back to the pH balance. You have a temperature set point of 98.6. If your temperature raises, you will sweat. If your temperature goes down, you will shiver. Your body will bring you back into balance. You also have a set point for your weight. If you deviate from that set point of your weight, your body will do whatever it can to bring you back to that set point. And the way it does it is it does it through raising your ghrelin levels 15-fold, 10-fold, and reducing these other hormones in your stomach called satiating hormones. The hormones that make you feel satisfied, the hormones that make you feel full. So it decreases them to zero. It increases your hunger hormone to tilt. And so it goes so high. So you're saying to me that this person has a willpower issue, when really it's their body trying to get, because mind you, why is it that if somebody loses, I don't know, let's say they lost 100 pounds. Why is it that when they lose 100 pounds and they start gaining, why don't stop at 25 pounds? Or then why they don't stop at 50 pounds gaining back? Or even 75? Why do they gain the whole 100 pounds back and then stop? Because their body has achieved what it wanted to do. And once you get back to where your body wants you to be, the hormones go back to leveling out. And so my job is to help, and we can do this now because we understand these hormones. And so my job is to help you level out these hormones. And there's obviously other things, metabolism we need to work with. And but like, we're putting all of this on patients when there's science behind this. There's science behind the management of obesity. And so that's what we need to be doing. That's why I wrote this book, because it's so, there's so much science behind helping people get to a healthier weight. And we can actually do it.
Dr. Hunt, I got to ask though. But let me just ask. Okay, you explained that beautifully. Thank you so much. Because in my head, I'm like, oh, that's what's happening. But why come we're not hearing more about these medicines to help control these hunger pains and all these other things? But yeah, we're seeing, Dr. Miami and all the people that's going to suck it and cut it out and all this other stuff. Like,
that's marketing.
Like, you see all that, but I'm not seeing the medicine that's going to help me. Like, nobody's even talking to me about hunger pains or all that other stuff. Like, why? Why?
I don't know. I think that the medications are on the newer side. The first one came out in 2012, and then the last one came out, I think, in 2014 or 16. So they are still newer. And again, there are not a lot of doctors who are trained in this. And so and they're going to be
comments though. A lot of wow, whoa.
There's going to be a lot of blockbuster but there's another one coming out in about 12 months that's going to change the game even more. But because what people don't understand is the reason bariatric surgery, you know how we say it's all about the size, is actually not in bariatric surgery. In bariatric surgery, it's not about the size of the stomach, because if that were the case, the lap band would work. The lap band, we make the stomach the smallest, and it's the least effective. In fact, we don't even do the lap band much anymore. Now we only do it 3% of all bariatric surgeries. So why then, if the lap band makes your stomach the smallest, why is it not as effective as the sleeve? Well, that's because the sleeve, we cut out 80% of your stomach, thus cutting out 80% of the ghrelin. So you don't get this signal in your head to say, eat, eat, eat. And if you go see a patient the next day, if you ask them if they're hungry, they're like, you know what, I didn't even think about food. And then if the sleeve is more effective than the lap band, then why then is the gastric bypass more effective than the sleeve? Well, you cut out 80% of the stomach in the gastric bypass, so you remove 80% of that hormone ghrelin, but you also do some replumbing work, and you take the intestines, what we call the hindgut, and you move it up closer to the stomach so it gets exposed to food sooner. And in that part of your intestines is where all those satiating hormones live that I told you about. And so they get secreted. So now you don't have anything telling you to eat, and you have these satiating hormones that say, hey, I'm satisfied.
Are we all
That
listen? That was a great explanation for help for everyone. Amazing. Yes. Wow. Wow. Yes. Like it's coming, Dr. Hunt, like boom, 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 these comments. Because nobody ever's taking the time to explain it that way. I just thought that, oh, you're gonna make the stomach smaller, so less food, I can't eat as much, then I lose the weight. But no one has been, and let me say this. In my experience, I've not heard many people talk about ghrelin, like all those hormones and stuff to really help you understand. And I think that's one of the things. When people don't understand their plan of care, they're less likely to adhere to it.
absolutely.
Absolutely.
Oh, listen, I can imagine all the
And if
conversations.
you even take that a step further with just understanding gut health in general.
Yes.
Oh yeah.
Just understanding gut health and all the other things that are associated with gut health, like your immunity, the bloating, so many people are bloated all the time. And if they don't understand how a lot of that has to do with how healthy their intestinal, mucosa is. So it's like a lot of medicine that you have to teach people so they understand how what they're doing, their behavior is directly related to the beings that they have. So if you say, for example, if you're eating a lot of stuff that's sugary, right? If you're eating a lot of stuff that has alcohol, you're drinking a lot of alcohol, you're eating a lot of sweet, you're eating a lot of, processed foods, it's going to proliferate all that bad gut bacteria. You're going to feel bloated all the time. Explaining that to people on a level where they can understand. Then the next time they pick up that donut, they're going to be like, that bad gut, I'm about to get bloated because this is sugary. So if you just tell people don't eat sugar and they don't understand the direct cause and effect of it on their body, a lot of times they won't follow through because they just don't know why you're saying don't do it. But if you tell people like Dr. Hunt just eloquently said, and you explain it and they understand it on their level, then they're going to follow through because now they get it. If I do this, this happens. If I do this, that happens. And if you don't want the end result of eating that donut or drinking extra liquor and feeling bloated for 2 days and you can't fit your outfit, what's in it for you is really what people want, right? So tell them what it is that's in it for them is going to be affected, and then the behavior changes.
Right. And you guys, this is why it's so important that you make sure that you go to a specialist for your specific problem, because just how Dr. Hunt just explained that so eloquently, now you understand and you're more likely to adhere to your plan. And I feel like there's a lot of confusion around not just those type of things, but even when you get to diet, like people, keto, paleo, low carb, and it's just interesting. All of the things that you hear, and I don't know. I love all y'all watching, but I don't know that people really understand the diets that they're trying to start or kickstart their weight loss journey. Because I was like, really? You could eat all that meat, cholesterol, fat, all this other stuff, and just no carbs, and it's okay, it's healthy? Like, because I think we were just, again, concerned about just dropping pounds. And I think what I was describing there was the keto diet. Because I'll be honest, it sounds weird to me that you can eat all those like bad fatty foods and lose. I mean, it helps you lose weight, but is that really still a healthy diet, or are you only supposed to do keto for a short period of time?
So, my I specialize in low carb diets,
Okay.
so that I can speak to this. So keto diet has been, and I talk about this in the book too, a keto diet has been branded as a bad diet. And to be honest, it could be a very bad diet. It could be, charred bacon, charred this. But a keto diet can also be a Mediterranean diet. So a Mediterranean diet is the best diet for your heart.
Mm-hmm.
And so what I tell people to do in my plan is to do a low carb Mediterranean diet. And why do I say low carb? The reason I say low carb, so let's explain what's the difference between low carb and keto. So keto is the actual number. So if you get your carbs less than 50 grams a day, by definition, that is keto. Anything above that, up to 150 grams of carbs, is just low carb. So when you go extreme low carb, that's when you call it keto. Now, that's a whole live talk in and of itself, but the bottom line is you can do a low carb keto diet and it'd be a very healthy diet. But the problem is it got branded badly when it first came out with Atkins, and people try to take advantage of it. But the point is, the reason that you do need to do low carbs is because sugar and refined carbohydrates raise your insulin level. Insulin is the fat storage hormone, the only fat storage hormone that we know. So if you're going to store fat, your insulin's going to do it. And if the insulin makes you store the fat, if your insulin is high, it locks the fat cell. You can't get energy out of the fat cell. So you need to get your insulin levels low in order, one, to release the energy that you've been storing in your fat cells, and to not allow the insulin to take that carbohydrate and store it as fat. And so a low carb diet is a good diet overall, because you don't want to stimulate that. I told you, this is all a hormone game. You don't want to stimulate your insulin. Now, is a vegan diet or a vegetarian diet a good diet? Absolutely. But I know some vegans and vegetarians that eat French fries and different things that are really bad for them, and they're diabetic, and they have triple bypass. And these are my patients. So just because the name is branded a good name, it doesn't necessarily mean it's a good diet. You can have a good diet in a keto diet, and you can have a bad diet in a keto diet, but you can also have a good diet in a vegetarian or vegan diet, and it go both ways.
And so I think that is really the options. What do you choose? What are your options that you're choosing when you choose to do keto? Are you choosing healthy fats like nuts,
Exactly.
avocado, olive oil? Are you doing, lean meat, right? Are you doing wild caught fish, right? Or are you doing tilapia that is filled with GMOs and just going to give you all kinds of GI issues? It's not just about, I'm just doing this diet or that diet. It's what are you choosing in your meal plan?
Yes.
Like your fish, you want to make sure it's wild caught, right? You don't want the farmed fish because it's filled with steroids and antibiotics and GMOs and all of that. You want to make sure if you're doing carbs, you're doing complex carbs. You're doing your oatmeal or sweet potato or, red potatoes, or, you're doing like complex carbs and not the refined high fructose corn syrup, bagels and waffles and croissants and, cereal and all those things that are packaged and processed foods. So you, like Dr. Hunt said, any of these meal plans can really work if you choose the right things to eat. So if you do keto and all you're doing is bacon and fat back and all that stuff, your cholesterol is going, the next time you check it might be worse than it was before you went on the keto diet. But if you're making better choices doing keto, like a clean keto, I don't know if that's
I like that. I like that.
If you eat it clean, where the options of foods that are on your grocery list are healthier, anti-inflammatory foods, organic foods, foods that are whole foods, foods that literally come from the farm to your table. You know what I mean? And not like all this packaged stuff. Then it can work. But unfortunately, most people aren't doing it that way.
I know, and we got to get better at it. And lots of people have commented, thanks so much for talking about keto. Everyone's really enjoying these conversations, the things that you guys are sharing. This is amazing stuff. Now, but let me ask this other question. So we're talking about, eating, low carb diets and all these type of things. But let me just bring it back a little bit to exercise. So a lot of weight loss and keeping our weight off has to do with diet and choices like that. Let me tap into this fitness because, so many, the American Heart Association and so many other organizations recommend 30 minutes of exercise 5 times a day. Is that really
5 times a week?
Excuse me, 5 times a day. 5 times a week. Sorry. Lord, where was I going with that? I know I don't do that. 30 minutes a day, 5 times a week. Sorry.
It's okay.
Is that enough exercise, or is that kind of just maintenance exercise? If I'm really on this weight loss journey, in addition to choosing healthier food choices, how much does exercise help, and how often should I really be doing it if I'm overweight or obese?
I mean, I can chime in, and Dr. Hunt can chime in. So the 5 is really maintenance, right? Because if you are already fit or you're already healthy and you're looking to maintain that, the 30 minutes of moderately intense movement, right? So it doesn't always have to be exercise like you're in the gym. It could be a walk, it could be tennis, it could be swimming. That's the other thing. I think sometimes people think of exercise and it has to be in a specific place, right? I'm an ER doc that travels for work. I'm a locums doc, right? So I do a lot of my exercises in a hotel room, right? I mean, when I'm traveling up in Maine and the hotel doesn't have a gym, where do you think it happens? It happens right next to the bed on the floor. So you can do exercises in your kitchen. You can do it in your bedroom. You can do it anywhere. So that 30 minutes is just movement. So let's start with that. It's just movement, moderately intense movement. Doesn't have to be in the gym. It could be anywhere.
Okay.
All right. So that is basically maintenance. If you are looking to lose 50 pounds, that within itself most likely won't cut it, right? Because you got to also do strength training. I'm a big weights, person. I'm a huge advocate for doing weight and strength training for burning more calories than cardio will. So you want to do your cardio, you want to do your strength training. You also want to incorporate your meals. So it's not just the exercise, it's what you're doing in the kitchen, your meals as well, your sleep, your stress management. Is so many different things. And like I said before, some people want to add supplements to, augment the actual exercise they do. So if you're looking to lose weight, I believe it's going to take more than the 30 minutes, unless it's 30 minutes of you really going hard at it within those 30 minutes, like doing HIIT routines and things like that.
Okay.
Yeah, that is the American Society for Sports Medicine. That 150 is just for maintenance. You have to get upwards of 240 to 300 plus minutes to help with weight loss. Also, keep in mind that.
Say that then, Dr. Hunt, why do doctors don't say that then? Because they have say this is what they say: 30 minutes a day, 5 days a week. But if you're already overweight, like what you just said, you said 240 minutes
plus.
Plus. So why? How come those? Like we need that real talk. So like with those numbers you just gave us. So if everyone's listening, if you remember that 30 minutes a day, 5 times a week is maintenance. If you're looking to lose weight or tone or do all those other things, it's actually more than that. So I'm sorry to interrupt, but I just thought that.
Yeah, no, it's and even when they talk about losing weight, it's a range, right? Because everybody's body is different. But the 150 is just for maintenance. But the other thing about weight management is that there's 80-20 there's an 80-20 rule. There's a lot of 80-20 rules in weight management, but one of them is that 80% of weight loss is diet. 20% of it is physical activity. You want that 20% because it also has good cardiovascular health. It helps with insulin resistance. It helps to maintain your metabolism. But if you just took the sheer arithmetic of it, so if you was on a treadmill for, I don't know, killing it for a half hour, it's going to give you 300-400 calories that you burned. I know people that could.
That's a Whopper.
Yeah, I was about to say, they'll just do it in a snap.
A Whopper is like 500 calories.
And
I
so
know they're yummy. Sorry, y'all.
So you got to understand that one, it's more than activity. There's something called NEAT, which stands for non-exercise activity thermogenesis. NEAT. NEAT is all the activity you do outside of planned exercise, like planning to go to a walk, planning to go to the gym. There's 168 hours in the week. If you go to the gym 3-4 times a week, everybody like, "Are you killing me? You go to the gym?" That's only 4 hours out of that 168 hours in your week. You still got 164 more hours that you could be doing something. You could be walking up the stairs. You could be parking farther away. You could be, doing all these other things that you could be doing with that extra 164 hours. And so this is what the strategy of weight management is about, to help you move that along. And the reason we want to make sure people get their diets right and also focus on their physical activity, but get their diets right, is because doc, I sprained my ankle. I can't go to the gym. That's why I gained the weight back.
I got bad knee.
Doctor, and so, but no, and so we put it all on the physical. I'm working too much. I commute into the city. So it's like you put all of it on physical activity, when yes, it absolutely contributes, and it does so much more. It helps you stay disciplined. So many things that physical activity does. But the point is that we really need to tell people that we want you to get that physical activity. And I don't want anybody to take away from what I'm saying, but we really got to get your diet right. And then you need to start doing, that's why I didn't say exercise. I said physical activity, because we really have to movement. We got to strategize. We got to start having people do more.
So if I'm sitting in my Zoom meetings doing this, does that count?
It does. Everything. I tell people, tap their feet while you're cooking. Move. Just move.
Dance while you're cooking.
Yes.
While you're cooking, y'all. We got 168 hours to burn after the 4 hours in the gym.
Yes.
And then, just like Dr. Hunt said, increasing the walking throughout your day. Right. Yeah. I remember when I went to Paris, I was just blown away how much the people walk there. They walk everywhere. And, because everything's so automated here, which is what you started with at the top of the hour, everything's so automated, we're not walking enough. When you have your Fitbit on and you set it to 12,000 steps, get those steps in.
Yep.
Right?
Yep.
Get those steps in. Take the stairs when you go into the next meeting. Take the stairs. Park a little farther. Don't use the elevator as much. Just get your movement on. I have clients who literally will bust out 10 minutes and work out in the office. They're like, look, I got 10 minutes before my next, meeting, or I got whatever, and they'll just knock out 10 minutes right there. You do that 3 times, that's 30 minutes. Right. So you have to change your thinking around movement. You have to change your thinking around fitness. You have to change your thinking around, how am I going to make this work with my busy schedule? Right?
Yeah.
So I'll tell you, I'm running a fitness company. I'm an ER doctor. I work out of 7 different states, right? I've got 7 licenses as a locums doc. I've got 2 special needs kids, all right? And I'm still finding time for my fitness. Why? Because it's a priority to me. Yep. Because this is the lifestyle I want. This is the way I want to feel in my body. This is the type of, livelihood I want to show my children, so that they see that same type of healthy way of being. So it really takes that change in your mindset to be able to do this.
Right. Guys, you know what? I mean, we had a couple of questions, but I think people were so in tune with taking notes that they didn't have as many questions to ask. You see them in the comments like, wow, really? Didn't know that. Like, yeah, talk about keto, like all of these things, everything that you've shared. I think you've given the audience more than what they could have even thought to ask. And this is great. Gosh, we gotta do almost like a part 2 of this conversation. I want to work that out because this was really, really good. But we're coming up on our hour, guys. You know, I really like to be respectful of people's time. We do the exam room every Monday, 6 p.m., 9 p.m. Eastern Standard Time. And this has been a great starter conversation because even though we're talking about it tonight, doesn't mean that that's the end of the conversation. You need to rewatch this video, take notes, talk to your doctor, talk to your healthcare provider, develop a plan, get things going for your healthy weight loss journey. I had some people in the comments ask where they can follow and make appointments with you all. So if you guys wouldn't mind, please, Dr. Lake, we'll start with you. If you could please tell the people a little bit more about what you got going on and where they can follow up with you, and then we'll go to Dr. Hunt.
Absolutely. So depending on what you want to do, I have a 12-week coaching program that's actually launching in a couple of weeks. So people who are serious about wanting to have one-on-one time with me, we're going to put a link in the chat where they can make an appointment with me to discuss, what their challenges are, and I can tell them, the services I provide and see how we can work together. I have tons of suggestions that I can give you guys. I also have a workout membership community, and I have a flash sale going on right now for people who want to join that community. It's a workout community where I come in there twice a week and I actually do teaching on topics like this. Topics on fitness, on self-care, on menopause, on chronic disease. All of that happens in the workout community. And I'm doing a flash sale for that. So we'll put a link so they can be able to join that community. And if they are looking for menopause specific, wellness and hormone balancing and all of that, I also have a menopause practice, especially for people who are really struggling with all of the symptoms of menopause. So they can reach me on all those different links. We'll put them in the chat. And they can find me on Facebook, on all social media, Dr. Di Fit Life, DRDIFITLIFE. They can find me that way.
Okay, wonderful. Thank you so much, Dr. Lake. Dr. Hunt, can you tell the people a little more about where they can find things you got going on, services and products?
Yeah. So I'm one of the 3 doctors. We wrote a New York Times bestseller called The Pact. So you can find me on the 3 doctors, and then I run a weight management clinic, and I wrote this new book about weight management because our clinic got so full that I wasn't able to see as many people. So my new book that just came out is called The No Guesswork Diet. I don't know if they can see it, but you can see that on my on my social media. It's Dr. Dr. Rameck Hunt on all platforms. And so, I do a lot of work with community, just the communities in general. So we have a mentor program coming up on the 23rd, and we're doing that with Derek Jeter's foundation. And so we do a lot of stuff. We're working on some other projects. So we just stay busy, and and I do this a lot because I'm trying to get the word out about obesity.
Yes. It's so important. And we appreciate both of y'all for spending the time. Listen, y'all, there was no copay for this visit. Okay. Because all this information should have been expensive stuff, but good stuff. This was really, really good stuff. And you guys, I know you all have benefited from it. I'm going to share this live with so many different people because both of these doctors so eloquently explain things in ways that can really help us to change our mindset, because now we understand. It's not just someone telling you what to do, right? Just because they're the doctor, but they've explained it to you. So, and we really appreciate that because that shows how passionate and how much you care about your patients as people, that you've taken the time to explain. Really appreciate that. And I love all the Black magic. Yes, I do. Yes, I do. All the Black magic. Because listen, people need to see more Black physicians, more Black nurses to know, and our younger people, so they know that this is possible. This is doable.
Absolutely.
We need a healthcare workforce that is reflective of the patient that we treat. And I'm not saying that our lighter skinned colleagues can't treat patients, but I think just having our experience, just the community that we have. Sometimes we can explain things in ways and better understand the struggle and provide more options and understand the obstacles a lot more than some of our other colleagues can. That's all I'm saying. No diss, no shade, but I do like the Black magic. I will say that. And thank you so much to blackdoctor.org. We really, really appreciate them for allowing, for having such a wonderful platform for, this is where culture meets wellness. They really, they have some great articles on their website. Please make sure to visit their website as well for other articles on topics like this and various other health topics. I'm Nurse Alice, and thank you so much for joining us in the exam room. We do this every Monday. Thank you for your comments. We will make sure that we answer them. And if you have any specific topic requests or things you'd like to know or guests you'd like to see on, please make sure to let myself and blackdoctor.org know. And then, so until next time, guys, make good choices, be kind to one another, wash your hands, wear your masks, and be safe. Bye now.
Absolutely.
Thanks.
Bye. See you guys.
Bye, guys. Thanks for having us.